Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium. And today I'm talking with Dr. Susan Kaye, a family physician who is chair of the Department of Family Medicine at Overlook Medical Center. And she is medical director for academic affairs for Atlantic Health System, a 5-hospital system in northern New Jersey. Susie, thanks you so much for talking with me today.
Thanks, Larry, for having me.
So for the viewers, or the listeners, I should say, who will be listening to this, I have said for many years, much to the embarrassment of Susie, that she is a role model, in my opinion, for how a residency director builds a sense of community by keeping a large network of relationships going with alumni. And my understanding, Susie, is are you the original residency director at your program?
I am not. I was the third. When I started as a program director, I was the third program director in the history of our program. Our program began in 1972, one of the first in the country after the initiation of the family medicine specialty in 1969. So we had our first residents who joined us in 1972, and the founding program director had been a very well-known, a very well-regarded family doctor out of the University of Pennsylvania by the name of Don Kent. Then there was another program director who was much shorter lived than he was. He was here for less time, Don Wernsing, and then I was the third.
Okay, and during that period of time, how many residents have you trained?
We've trained over 300 residents since our inception. And our residents are practicing all over the country. About 20% of them are in academic medicine. The vast majority of them are in what used to be single family practices, in the community-based practices. And a small number of them went on into administration, worked for insurance companies, now work at ACOs, that kind of thing.
So you have really done a fabulous job of keeping connections with your alumni. Let me just ask you to, it may seem like an obvious thing to you, but why do you do that? That takes a lot of time and energy. It takes staff. It takes resources to do this. Why is this so important to you?
Well, our program, I say this to applicants, I think family medicine programs have personalities, like families have personalities. And our program definitely has a personality. And when we graduate residents from this program, they go out into communities, both near and far. People will often say, I knew that person trained at Overlook Medical Center. There's something about the way they approach clinical care. There's something about the way they approach collegiality. There's something about the way they approach their professionalism that is sort of thematic, and it has to do with the environment that we establish for training. And so the reason we keep those contacts, or the way it's evolved over time, it's just like when a kid leaves your family, you stay in touch with them. And you stay in touch with them, in this case, for almost the rest of their professional careers. There are very few people who graduate from this program since its inception that we do not know where they are. Now, I can't claim credit for this. This began with the program director before me, who put into place some particular events that we do. We could talk a little bit about that, but the atmosphere was really created by our founder, who really who said to me when I took over as the program director, he said, I want you to take a proprietary interest in this program and in our practices. Act as if you own them, act as if they belong to you and they're yours. And I think that theme, that sort of personality of practice has permeated everything we do.
So tell me a little bit about some of the things that you intentionally do to help create that culture, number one, and then then in terms of maintaining that relationship. I will tell you there are a large number of residency programs that they don't have email addresses. They may have names, but they don't have email addresses, and they certainly aren't in regular connection. But what do you do? How do you pull this off?
So we started probably about 10 years into the program. We began in 72. In 1982, I believe, we had our first reunion event. And we were 10 years young. And so we were young enough to know where a lot of our graduates had gone. And many of them, honestly, had stayed relatively local in the Northeast and had maintained connections with our faculty and with our other residents. And so the first, what would become for a while an annual event, something we called the family practice in those days, the family practice update, began in 1982. And it was an event where we invited back all of our alumni to participate in the CME program. And it was intended to be a CME. Doctors will travel for CME. They can, get the flights paid for, and they can stay at a hotel, and they can do those things if they're getting CME. And so it was an attraction. So it started the evening before. We would have a dinner where we would all get together and see each other and hang out and find out what everybody was up to. And then the next day, we would have a CME event that was hosted by, at the time, the program director and chair, and it would usually be thematic. In the beginning, the event was only for family medicine alumni and faculty and current residents and staff. We expanded that some years later, or I did, to include members of all of our departments, because we would take themes that were of interest to all kinds of practicing physicians. So over time, this event grew bigger and bigger and bigger until the last 3 years or so, or the last 3 events or so, we've had, can have at times close to 200 participants from across all specialties. So, it was an attractor. It was happening every year for a very long time. As time went on, and by the time I took over the program, I realized that every year might have been too frequent, that we needed to give people, number one, a break, because we thought if there was time between them, more of them would come back. If they hadn't been here in 3 years, they would be more likely to come than if they had been here last year, or the year before. And it sort of led to sort of an anticipation. There was excitement around the event. When people heard we were hosting it, they were really excited to come back and to participate. So now we have it every 3 years, and in a large part, quite frankly, because it's a lot of work. And as it's grown and grown and grown, we've had more and more alumni and more people show up. We've got to house them, we've got to feed them, we've got to put on a big CME program. So now we're every 3 years, and that seems to be the sweet spot. People come back, they look forward to it. It can be big enough that we can get really prominent speakers. For example, one year we had Zeke Emanuel come and talk. So now we can get national speakers to come because the event is big enough, which even draws more alumni to the event.
So how do you fund this?
How do we fund it? So in a variety of ways. In the beginning, I scrapped together money from all over the place, but there is a fee to come, right? So there's a registration fee. It's nominal. It's not much, but it's something. The event the evening before, which is a dinner and a party, is paid for by those who participate. And the CME program is paid for either through department dues, which I instituted some years ago. I instituted department dues, and also every year our hospital has an annual fundraiser, which all hospitals do. And probably about 10 years ago, I had our foundation, who's the fundraising arm, put a place on there where alumni could check off they wanted their annual gift to go to the Department of Family Medicine for family medicine activities in CME. So not only do we have dues that we use, but during the annual drive, a lot of our alumni designate money for our department.
So when you're speaking of dues, you're charging the individual alumni a fee?
No, we charge our department. We have annual department dues. The family medicine department members here pay dues. And we use those dues to fund CME programs. Because remember, this event, we invite the entire Department of Family Medicine of all of our hospitals to attend. And depending on the subject area, we might invite internists, pediatricians, surgeons. It really depends on the topic or the theme of the event. The event is usually we get about 5 hours of CME in. So there's a morning program, a break from lunch, and an afternoon program. And at the end of the afternoon program, we usually stop at about 2, and then we would tour our alumni around our facility, around our family medicine center, because about every 10 years we built a new family medicine center. A lot of the alumni had not seen it, so we would provide tours and bring them back to the residency program site so they can meet residents and meet staff and people maybe they had worked with who they hadn't seen in a long time, and tour the facility.
Is there also a social event associated with that?
So the social event occurs the evening before. We have a big dinner, and that is just alumni and current staff. It's not everybody who shows up at the CME program. It's an alumni event. We have it at an event space in the area. It's like a formal, sort of dinner. It's not formal, but, people get dressed up, and it's, table service. And although sometimes we've done more casual things, sometimes we've done buffets. Every year we've changed it up. It depends on the subject and how people feel about it, but it's a dinner the evening before. And then the following morning, there's a small breakfast that people show up early and get to see each other. And then there's a break for lunch. And so during lunch, people can see old alumni, friends, and then the program ends between 2 and 3.
In terms of funding, do you accept or do you recruit external funding? In the old days, pharmaceutical companies used to.
We do not, and I would not.
Okay, fair enough. How do you keep track of where your alumni are? Whose job is that?
That job belongs actually to our residency coordinator, who keeps track of where our alumni go. When they leave, obviously we get all their contact information, but we also have an annual alumni newsletter. And in order to send out that annual alumni newsletter, we need their email addresses and their home addresses. And we also have all their phone numbers, their mobile and their home phone number. Each year we send out a newsletter. If it gets rejected because it doesn't arrive at the right place because the individual has moved, we know that they've moved, and we track them down. There are just a handful of alumni. We've graduated hundreds and hundreds of people that we do not know where they are. We knew one of our residents who had gone to Africa as a missionary after he left, and kept in touch with him and found him when he came back and moved back to Michigan. So our alumni are all over the country, and we start tracking them the minute they leave, because we have to make sure we can get them their newsletter, and they love the newsletter. They want to receive it, and we often get comments from them when they do get it, how happy they are to have received it. So we can figure out if we don't have current information when the newsletter gets returned.
So when you're talking about the newsletter, is this the newsletter?
That is the newsletter. That's correct.
Okay, I'm holding up a copy of it, which Susie was kind enough to send me. And number one, it's really well done. Kudos to you and your staff and how you've put this together. One of my questions is who writes the articles? Now, some of the articles are written by leaders in your organization, medical directors, the director of osteopathic education, but some of the articles are written by, I can't tell who's, I'm looking for one right now. You've got one from your behavioral person here. Who writes the other articles?
Right. So the articles are written by the faculty, and each one of them has their own sort of curricular areas of responsibility. So each of our medical directors from our ambulatory sites, our residency training, and writes a thing about what's going on in their particular practice, Overlook Family Medicine and Chatham Family Medicine. We have an osteopathic track here, so our osteopathic director writes something about what's happening there. We always have something about the Benjamin Josephson Fund, which is a fund that I run that provides medical professionals with financial resources to travel to communities that are resource poor communities, to volunteer their time to deliver healthcare. So there's always something about the Josephson Fund. And oftentimes there'll be articles written by our graduates or our residents who have been recipients of a grant to travel internationally, and they'll write a little something about their trip and what they did. There are faculty who have particular areas of interest and research. So many of them will write an article if there's something current. We have something here on Aid in Dying, which is a program that we recently instituted And so one of our faculty did that. If we have grants, there'll be a little article on the grant. It will oftentimes be written by the person who's really supervising the grant. So we have something here on our community health worker that was written by one of our social workers who's involved. We'll have articles on other activities that are going on around the healthcare system, our mentoring project, our URM project. If there's been publications done by any of our faculty or residents, might have something on research publications that are occurring. We always do a little bit of something on the annual FMEC meeting and what the kinds of things that have happened. But then we add things that our alumni might be interested in. We will ask an alumni question. We ask one question pretty much every year of our alumni, and we ask them to tell us something about themselves or about what they're doing. We might ask them, for example, about when the ACO movement started. How has the development of ACOs affected your practice? We asked them this year about how the pandemic had affected them personally or professionally. And so we'll have short stories by alumni that will respond to a question that we ask them. And then we have a column called Alumni Matters, which is the traditional thing, you know, that you get from your university. You'll get something every year. Tell us what you're doing and what you're up to. You know, and I have a little thing about each class. Well, the class of 1959 is, you know, all this stuff. So we do the exact same thing. And we ask them to tell us what's up. And so they all write little things about what they're up to, what's happening with their family, what's happening professionally. You know, now we're old enough, been around long enough that we have alumni who are retiring. So they'll tell us, we actually once did a piece about retired alumni and the kinds of things they were doing personally and professionally. And so we have, you know, pages about just the alumni shout outs from them saying, hi, this is what I'm up to. This is how you can reach me. If you want to find me, my dear class members, just like you would have in sort of any alumni magazine. So it's a real way that have kept our alumni connected. And sometimes they'll read something, a little snippet, you know, only a paragraph or two paragraphs, the Alumni Matters section about the alumni, and they'll say, oh, I haven't spoken to Martha in ages, and they'll see how to contact her and they'll get in touch. So it's a way for them to find out what's going on with their once upon a time peers and with their, you know, their classes, their graduating classes, and keep in touch. So that's another way. And we advertise on the years that we do our big CME program, we will advertise the CME program in this as well. So they'll know when it's coming, they'll be prepared to come, they'll set, you know, save the date. We do a save the date for the update. And so they'll know when and it's always in May. So we always do the update in May. So
now this says volume 28, number 1, fall 2020. Is this an annual newsletter, or is this more often?
It is an annual newsletter. We used to try to do it. It would be hard to produce something like this more than once a year. We start thinking about it in December. We start writing the article, you know, we start thinking, what should we do next year? We start writing the articles January, February. We wind up publishing. This came out in the fall because of the pandemic mostly. It's usually published in the spring. We usually publish it in the spring. So it takes us about 4 months to pull this together.
You've got dedicated staff providing support?
So the person who really moves this project is Stuart Green. He is our full-time behavioral scientist, behavioral health person who works full-time faculty member. He is the editor of this. And he now has sort of a story list of all the people that will typically write articles every year. I mean, I always do something, a chair's report, or program director does a program director report, certain people over and over. And then he comes up with new ideas for this, and each of other faculty might come up with an idea for what we might want to, kinds of topics we might want to add to this. And he and I sort of have ultimate say of what goes in and what doesn't get to, you know, what doesn't make the cut, or we just don't have the space. So it's really a collaborative project between Stu, who does most of the legwork, and me, who does a fair amount of the editing as well.
In addition to the newsletter, in addition to the alumni event, the CME event that you have every 3 years, are there other things that you do that you think help build a sense of community among your the people associated with your program?
Yeah, so we are a community-based academic medical center. We've had over the years, many of our graduates stay in or around our community. And so a fair amount of members of my department, my hospital department, are graduates of the program. So we have department meetings all the time, right? We have them every other month. We have a full department meeting. It used to be in person until the pandemic, but it will be in person again. It always has a CME program. It always comes with lunch that I pay for, not funded by a pharmaceutical company. And so a lot of our alumni will see each other at our every other month department meetings. So that's something that keeps us connected. We have a fair number of our graduates who now work for one of our sister hospitals. And we have people come in, our alumni now, we started an alumni program where they will give lectures to our residents. We reached out this year for the first time to alumni all over the country and said, now that we're using Teams, now that we're doing team lectures, for the residents, how would you like to be an expert and do one of our noontime conferences? So now we have alumni who have raised their hand and volunteered to give our residents during their core didactic curriculum activities to participate in them and to run them. So that's a new project that we started this year because of the remote nature of our didactic sessions. And we drew in alumni that we hadn't really engaged with for some time now. We also have alumni who precept at our family medicine center. They do it on a volunteer basis. It keeps them connected to the program. It also allows them to watch our residents work and to see which ones they'd like to have join their practices. So it's a recruitment opportunity for alumni if they want to volunteer their time to precept in the family medicine center to get to know the residents. And it really is a way some of our community-based practice have grown their practices is by selecting residents from our resident staff who they've worked with for 3 years, knowing what kind of doctors they are and bringing them into their practice. So that's another way we've maintained contact is through allowing them the opportunity to teach, which a lot of community-based doctors, sit in their offices all day, see patients. The opportunity to teach the next generation of family physicians is a real unique one. Practicing doctor, and so a lot of them have continued to do that for us.
Other things that you do to build this sense of community?
I think those are really our major activities. I keep in touch with the residents a lot. They know one of the benefits for being here for such a long time, I've been here for over 3 decades, is that I know almost every single graduating class. Since the inception of the program. I know every class since 77, and the program started in the first graduating class was 75. So I have been a thread that has sort of, that has been woven throughout the training program. And so alumni, when they want to hire, where they're looking for additional partners, when they have questions about about changing their professional trajectory, when they're, thinking about doing volunteers, will call me because they know where to find me because I've been in the same place for so long. And so I think that the history of having people who've been here a long time allows people to feel and stay connected. The other thing that we do actually is just, is informal. I'll get a call from a graduate in the community. He'll say, hey, want to meet for drinks after, it's 6 o'clock tonight down someplace. 4 of us are getting together because 4 of them they're in different practices, they're out in the community, but we're close enough geographically to get together. And so that's more of an informal thing. But the historical perspective, the continuity of leadership, I think is one of the things that has allowed the program to continue to do an enormous amount of outreach to our alumni, and for the alumni, quite frankly, wanting to stay connected, because there's a lot of faculty who have been here a long time and they've been through many, many, many graduating classes, right? And so there's that connection as well.
So one of the things that I know about your program, and you mentioned it, the Josephson Fund, that will pay for physicians and nurses, I believe, to travel to the four corners of the globe doing missionary work. Do any of your alumni contact you and apply for funding support so that they can go and do some missionary work?
Yes, all the time. So we have a core. We have a number of alumni who are very dedicated to do voluntary medical work, and who have gone back to the same locations over and over again. We will refund them constantly. So we have a fair number of alumni who have reached out to the Josephson Fund for funding for work. And then we also pay for our residents. Our residents have the opportunity to do that. And once they get hooked on it, they oftentimes will carry that into their work after they leave the program. So they'll come back and say, I'm going to try to, take some of my vacation time and I'd like to spend some time. We send people all over the world on it, truly all over the world. So that is another connection. They know there's funding available for them, and that they'll be able to continue this, something they start in residency, they'll be able to continue throughout their professional lives. It is a life-changing event to go to an undeveloped country, to a resource-poor environment, and work there and see the difference in healthcare and the difference in health equality, and bring those experiences back to here and look back at the American healthcare system through very different eyes. It really is an awakening experience, particularly for young physicians who really have just trained in this country and don't understand the kinds of resources that we're blessed to have here that we don't see in a large part of the world. So I encourage all our residents to do it. Not all of them are as adventurous. It takes a bit of an adventurous spirit. Get on a plane and fly to a place where you're going to, have no electricity and maybe have no running water and work. But once you start working alongside people who have done this for a really long time, it feels quite comfortable, and people tend to do it over and over again. So that's been a wonderful addition to the program.
So that fund, you've told me the story in the past of how you recruited the financial support that underpins this initiative. And I'm not going to ask you to do that now because of time, but if people want to contact you, I'm quite sure you'll tell them how this I think is a very unique asset that you've developed in your program that not only is helping your program, but it's obviously helping deliver care to people in resource poor parts of the world. And I just think it's a fabulous idea.
Yeah, so let me say something about it. And it doesn't have to be at a global site. So the mission statement is to provide medical professionals with the financial support to deliver care to underserved communities. That really what it is. So that underserved community can be right here in the United States. During the height of the AIDS pandemic, we had people working in HIV clinics in San Francisco. We've had people work on Native American reservations. So it's underserved communities, and I'm the one who's allowed to interpret what that means. But it does not have to be a global experience. It can be right here at home, delivering care to underserved communities. I encourage everybody, you go www.bjfund.org, and it describes the program. We fund medical professionals, which means licensed physicians, nurses. In one or two cases, we've done some pharmacy work, some pharmacists. It depends if they're delivering clinical care. And we fund residents. We don't fund medical students because they're not licensed and they're learners. And so that we unfortunately don't fund medical students, but we do fund residents, faculty, private practicing physicians, and other healthcare professionals to deliver care in resource poor communities. So I encourage people to go to that fund and to apply for financial support.
If you want to hear the background story, that the rest of the story, as Paul Harvey used to say about how Susie created this fund with the support of a philanthropist, physician philanthropist in her system, I will let you contact Susie directly and she can tell you the story. In the final minutes that we have here, Susie, are there any other things that you do that help build this sense of community with your alumni and between your alumni and your current operations?
I think, no, I really think the sense of community is built while the residents are here. So we have a real tight set, as I started this conversation by saying, I think that residency programs have personalities, and ours has one, like families do. And we start by creating an environment, a familial environment within our program itself, an environment where residents can call faculty by their first names if they so choose, an environment where the staff, the non-physician staff, are close. We have several annual events in our program up until the pandemic. We have an annual graduation party, of course. We have an annual orientation party at a faculty member's house. We have an annual holiday party. And when we do this, we invite alumni who are in the area many times to attend these events. So that brings them in to our, to our 3 or 4, probably have 4 social events a year in our program. And some of them we invite alumni, but mostly we create an environment that's welcoming. And so when people leave it, they sort of want to come back. They long for that sort of familial, sort of embracing culture. And so they leave, and it's not hard for them when we say, hey, we're going to be doing something, for them to want to come back. They also will just show up when they're in the area. They're coming to visit family, and they'll call and go, oh, I'm going to be in the New York metropolitan area. I'd love to stop by. Come on over. So I think it starts with the tone that's set during training. And if you set that tone during training, when your trainees leave, they will want to stay connected. And I really do believe that's how it's happened. It happened because people wanted to come back and see the founding members of our program. Anytime they were invited, they couldn't wait to come back and see Dr. Josephson and Dr. Kent. And, once they retired, there was a new group of faculty who were here with longevity and relationships. So I think it's all about relationship building.
So you have everyone's email address and you put time and energy into maintaining that. Do you communicate with them have you created like a listserv where you're able to send messages out, or where people are able to, share news coming back to the program throughout the year?
That we have not done, because we do our annual newsletter and we share news that way, right? We do it in a published format. So we do not have a listserv. I think a lot of this is about time, effort, and, and somebody has to maintain it, right? And so we do not have a listserv. But I will reach out once a year as a fundraising, right? I fundraise once a year with them. So I'll reach out to our alumni during fundraising events. But we've talked about doing a listserv or having some kind of blog or doing something on social media. We just haven't gotten around to it with all the other things that we're doing. You really need the time. And I think you need one really young faculty member who's enthusiastic about maintaining that kind of social networking, right? So, but we do discuss it, and I think eventually it'll get done.
Well, Susie, I want to thank you very much for talking with me. What you do is fabulous. When I talk to your graduates, when I meet them, I can tell what you're talking about, the culture and the sense of belonging that that people have, feeling rooted. No matter where they are, they're still connected with something that's very important, played a very important role in their lives. And I just think it's fabulous. And again, want to thank you for talking with me today.
Thanks for the opportunity to do so, Larry. Appreciate it.